Hello students, let us continue with discussion about health in detail. In this lesson, we are going to learn more about health and the concept of health. Apart from that, we are going to learn the various models that are proposed by health psychologists to understand the intricacies that are involved in health behavior. We are also going to see how these models try to explain or predict health behaviors. Theory is a very important aspect of knowledge. Without having a theory, it is very difficult to get facts. In fact, even Albert Einstein has to say that it is the theory that decides what we can observe. So, theories help us to make assumptions about the kind of data that has been collected, and theories serve as frameworks for us to understand the direction of research and also to make interpretations of the research findings. Now, all of you might be aware that researchers collect data in terms of numericals, that is in numbers. So, how to make meaning of these numbers? Having a theory helps the researcher, and theories guide the researchers to the kind of analysis that they have to subject their data and also the kind of interpretations that they have to make. So, in health psychology also we have several theories to understand health behavior in detail. And psychologists, health psychologists especially did lot of work trying to identify the theoretical concepts behind health behavior. Now, this has helped in the furthering of knowledge in the sphere of health, and especially their work on stress and stress related behaviors helped later research a lot. Now, because of their work today almost everyone is aware of the impact of stress. Almost every other person knows that stress is not good for health and that leading a stressful life is one major factor that will affect their health. Thanks to the efforts of health psychologists in trying to formulate theories on stress. Like that, in many other aspects also, health psychologists framed theories. Now, to understand the concept of health, there are several theories that are postulated. The first one is health behavior model theory, which is a highly influential theory and a forerunner to other theories in health psychology. The development of this theory, called the health belief model, led to lot of research by health psychologists, and it raised lot of debate in health psychology field, and many other researchers got interested into developing theories. So, the health belief model is an important model to trying to understand the concept of health. According to this model, which is cognitive behavioral in nature, that is where lot of cognition and perception is involved. So, according to this health belief model, 4 important components are involved. The first component is the perceived susceptibility of the disease. The second one is perceived severity of the disease. And the third component that is involved is the perceived benefits, and the fourth one is perceived cause. So, susceptibility, severity, benefits and cost. These are the 4 concepts that are involved in the health belief model. Let us see how they are actually explaining the concept of health. In this slide, the health belief model, you can graphically see how the various components of this model are interrelated to each other. And in this model, as you have observed, many other components are also included. which are a result of later research by health psychologists. To begin with, first perceptions and modifying factors are involved. So, what are these modifying factors? The demographic variables, socio-psychological variables and structural variables, which contribute to assessments regarding benefits and costs. That is, assess sum of perceived benefits minus perceived barriers of preventive action. And the second one is perceived seriousness and susceptibility, and the third one is cues to action. Cues to action can be giving knowledge or information about a particular disease. So, this in fact leads to perceived threat or illness of or injury. So, when the illness is perceived as severe and the threat is great for the individual, then only it will result in likelihood of action or likelihood of preventive action if it is to do with preventive kind of a program. So, all these components work together, resulting in the final output of likelihood of action. So, this theory, the health belief model, it does not guarantee that a person will take or opt for treatment or opt for any kind of screening program. It tells us like what are the components that are involved in the decision making process of the patient and what might result in taking an action. So, in this model, the other criticisms are there is no social or environmental factors component, and earlier we have seen the importance of social and environmental determinants of health. But in this model, there is no discussion about social or environmental factors. Apart from this, this model overemphasizes on the factor that a person rationally assesses all his or her decisions. Now, they explain that every person will try to analyze the benefits that are involved and then the cost that the person has to take. Now, we know that many of our behaviors are not so well planned or well researched upon. Many behaviors we spontaneously act. So, this health belief model states that everything we reason out and think a lot about and then take action. So, that is another criticism for the health belief model. Health psychologists try to study a lot on each of the component that has been suggested by the health belief model. For example, they did some studies on health susceptibility and health barriers, and they had found out that perceived severity and also perceived susceptibility are the ones that are directly related to likelihood for action. And they have also found that if information is given as a cue for action, then also it resulted in likelihood of taking a health related action. Apart from that, showing videotapes, for example, of people say who go for Alcoholic Anonymous. There is this person who is a compulsive or a chain smoker. So, when they showed videotapes of other people attending de-addiction programs, then they found that there is a likelihood of this person also seeking that kind of treatment. Apart from that, giving them information or arousing fear in the participants also led to a positive outcome on the part of the patient to seek treatment and in the general public to seek preventive screening programs. The second theory that tries to explain health behavior is protection motivation theory. This theory is developed by Rogers, and he developed as a further advancement of the health belief model. And in this, he lists out 5 major components. In this you can see all the 5 components that are listed by Rogers in his protection motivation theory. They are severity of illness, vulnerability to the disease, response effectiveness, self efficacy and fear. These are the 5 components that he listed, and according to him these 5 fall into 2 categories called the coping appraisal and the threat appraisal. Under the coping appraisal, self efficacy and response effectiveness comes. Self efficacy is being confident that yes, I can undergo this treatment program, and response effectiveness is yes, I am in a condition to change my diet, and changing my diet in fact improves my health, the confidence. So, both these come under coping appraisal. Coming to the second component, he says that these 3 components, that is severity, vulnerability and fear, they come under threat appraisal. So, using these 5 components, Rogers tries to explain behavior, and just like the health belief model, in this theory also there is no social or environmental factors that are involved. Here emotions are involved, unlike in the health belief model, because the emotion of fear especially is included in this model. So, although it is a development of over the health belief model, still it is not a model which includes all the various components or determinants of health behavior. As a response to criticisms of early models, health psychologists developed other modern models to explain the concept and determinants of health behavior. One such model is the theory of planned behavior. According to this theory, there are 3 major components that are involved. The first one is attitude. Please have a look at slide. You can clearly see all the 3 components. The first one is attitude, which is behavioral beliefs weighted by outcome evaluation. And the second component is the subjective norm, that is normative beliefs weighed by motivation to comply. And the third one is perceived behavioral control, that is control beliefs weighed by influence of control beliefs. So, you can see here clearly that each of these 3 components have an effect on the other component. It is not that they are unrelated, as you have seen in other earlier models. The new addition here is that both attitude, the subjective norm and perceived behavior control interact with each other, and all these 3 together have an influence on behavioral intention, which finally results in behavior. So, here behavior means taking or seeking treatment or agreeing to enroll in health screening programs like regular checkups, or agreeing to visit the dentist, or even adopting healthy lifestyles. All these are indicative of behavior. So, in this model you can see that the social and emotional components have been involved. So, to explain in other terms, this theory of planned behavior, it includes the kind of attitudes that a person has regarding their health. That is, if suppose do they believe that having a healthy lifestyle is important, or do they think that no, if not now, when will they enjoy in their life? Why is it that they have to be very strict and not eat anything in spite of all the wealth that they have? Some people might be holding such attitudes, and some people might think now I am healthy, why should I do all these things? When I get any illness, then I will try to look. So, the kind of attitude that a person has regarding the health has lot of impact in the kind of behaviors that they show. And on the other hand, there might be some people, for each and every small thing they get over alarmed and they rush to the hospital. Even for a minor cut, they make lot of fuss and then they seek doctors very actively. So, certainly the kind of attitude is very important in determining the health behavior. So, apart from that, other thing that the theory of planned behavior mentions is the subjective norm. That is, what are other people around me doing? Is everyone eating these like me, or is everyone in my friends circle are enjoying? They are eating what they want, when they want, they are sleeping in late nights, they watch late night shows, they go for parties. So, what should I do? So, these are the social norms. So, we weigh our behavior and we also decide what to do and what not to do depending on the social norm around us. Otherwise, if say for example, an youngster spends a lot of time doing yoga and meditation, however healthy and good it is, the friends might jeer at him, saying why you need to do all this from now onwards, and that this person is a saint and things like that. So, social norm is, even though our attitude is positive, but if everyone around us do not support that attitude, there is a high likelihood that we will not engage in that behavior. Apart from attitude and social norm, this theory also explains perceived behavioral control. For example, if we say because a particular person has a genetic predisposition to diabetes. So, if the person we cannot ask the person to never eat sweets, probably this person, although has a genetic predisposition, loves sweets. So, when a kind of behavioral change is suggested, whether the person is able to put that in practice or not, or we cannot ask, for example, a person who has genetic predisposition for cancer, but belongs to a very low socioeconomic status, to go for regular health checkups, because at least 3 months once they have to go for checkup, which is quite expensive. So, the perceived behavioral control involves whether the person is able to do that behavior because of various other reasons and income that is involved. So, research has shown that when the perceived behavioral control is high, then the person is likely to engage in positive health behaviors. The next theory that tries to explain health behaviors is the theory of reasoned action. This is also another cognitive behavioral model where lot of cognitive work is needed on part of the individual to undertake any kind of health behavior. According to this model, they suggested two causal factors. Unlike other theories, they separated different components. This theory also tries to list almost similar components as the theory of planned behavior. But here in this theory, the researchers Azjen and Fishbein, they try to identify these two as separate roots. Here the two roots you can see. The first root is to do with attitudes about behavior, which is affected by the beliefs about the behavior and the evaluation of the behavior itself. The second root is the subjective norm, and subjective norm is consists of opinions of referent others, that is significant others, and also our own motivation to comply to them. Sometimes even if our attitudes are different from the subjective norms, still if we are highly motivated, we neglect what others say, or we do not mind what others say about our behavior. We continue to do that. If suppose a person believes that doing yoga is really very good, and if there is no one else in that family or friend cycle who is doing yoga, still if the person is highly motivated and has a lot of faith, will continue to do that kind of behavior even if others are not so accepting of this. Of course, today yoga has become a highly accepted health discipline or health regenerative and preventive program, unlike in earlier days. Earlier days it was not an accepted way of behavior. So, if a person is highly motivated, that is have strong attitudes, even if others support him or not, they will comply with that behavior. But if suppose the attitudes that they have are not so clear, and if the attitudes are not so strong, or this personality is not strong, this person's personality always looks up to others for approval and suggestion, such kind of person, even if they know that doing that behavior is good for them, still because they are afraid what others will think of them or whether others will approve them or not, that puts them off from doing that required action. So, in this theory of reasoned action, as you can see in this diagram, there are two different routes. So, both of them have an effect on the intention, and intention is a best predictor for behavior. If they intend to do something, many of the people finally tend to do that thing. So, the strength of this model is that it involves both the social component as well as the cognitive component, and it gives much more clearer picture about intentions to act and health behavior outcomes compared with other earlier theories. This learning theory, unlike the earlier theories, is not cognitive in nature. That is, people will act based on the kind of rewards and punishments they get. That is what this learning theory believes in. So, if the person is shown the negative effects of a particular disease, say for example, if you smoke, you are going to get cancer. So, that kind of punishment that is involved in that will help the person to not indulge in that negative behavior, and also it might help the person to seek medical treatment immediately if the person is already a smoker. So, the learning theories of health, they emphasize not on any cognitive or cultural components, but another different component which is also important, because yes, sometimes irrespective of what we think and feel, if we get to know that it is going to, we are going to be severely punished, or we are going to be afflicted with serious illness, because of that fear of becoming ill, then many people seek health relief treatments. So, learning theory also contributes to understanding health behaviors, and sometimes the reward that is involved. If you go and seek treatment now in the initial stages, then you will become well soon, and the disease can be controlled. So, that is a kind of reward that the person receives of seeking treatment in the earlier phases, or if you adopt particular kind of lifestyle, then you will not get so and so and so diseases. That is also a sort of a reward campaign that might help many people to adopt the right kind of health practices. So, learning theories contribute to understanding health behavior basing purely on rewards and punishments to a great extent. In the learning theories, social learning is another component that is involved. As you might be aware, social learning is observational learning. It is not that only if you get cancer and if you really have to experience the seriousness of the illness to know the effects of cancer. Even by observing others suffering from cancer, you get to understand the severity of the illness, the kind of suffering that a cancer patient has to undergo. So, observational learning happens a lot. So, these theorists who propose these social learning concepts, they try to develop their programs in such a way that by observing either videotapes or by sharing information, the person is motivated to behave in a positive manner. By giving rewards to the person, say for example, if the person takes regular checkups, they might offer some kind of incentive to the person who takes regular checkups. So, there are so many other campaigns that are involved by showing, even on TV there are so many advertisements by the government health organizations where they show people who are suffering from a particular disease with an idea that those who see these shows, they will learn that they have to take some precautions to not get that disease. So, social learning theory is another important theory to understand the health behaviors. So, in this lesson we have not only seen what are the important determinants of health behavior, we have also seen the various models of health behavior, including the health beliefs model, the theory of planned behavior and social learning theories. So, this indicates that there are many components that are involved, and sometimes even if our attitudes support us to go for a campaign or to go for a program, the influence of others might hold us back. So, gaining this knowledge will make us be more cautious about what others say about our behavior, and we might make efforts not to listen to them, but stick on to our right attitudes.